Yes.
Checking. Can we hear it?
No.
You don't hear it?
Yeah.
No. Can you hear me now?
3 people are viewing already.
Please.
Can you hear me now?
Oh,
Yeah.
we are on. Okay.
3 people are viewing already.
This has been a trial in trying to get the. Yeah, you're gonna have to mute your sound, I think.
Yeah, right now.
This has been a trial in technology and trying to make this work. I think we got it, but it's not the professional level we were hoping to achieve tonight.
Let me see.
I think we got it, but it's not the professional level we were hoping to achieve tonight. Yeah, you're going to want to mute that.
Yeah.
Because they're going to hear it on a loop.
Double.
It's going to be feedback city.
Okay.
So good evening, everybody. This is Brian Harrison with Mountain House Matters on your MoHoTV. We're doing a premiere episode of Mountain House Health Matters. And this was sort of thrown together at the last minute. We were planning to do it at the studio at Zaytech, and that didn't really work out. So we were going to try and do some other options. So we've had some technical difficulties. But I'm sitting here with Dr. Satyakant Chitturi from the Assure Primary and Urgent Care Facility in Mountain House over by the Safeway Center. We were going to do it at the store there too, but that didn't work out either. So third time's a charm. Huh? Anyway, before we get to that, if I can, my phone's doing something. If I can do a little bit of news reporting before we do anything here, I'd like to share with you. I don't know if I can even, how I even do that. I don't think I can do that. There was a report on social media, I think just on Facebook tonight, about a serial killer going around in Mountain House. Turns out, I checked with our PIO, the Public Information Officer at the city, and it is fake news. The picture of the guy that was on there, I guess I'll just show it to you. This guy, the post looked like that. And it was threatening that this guy was a serial killer out scaring people or maybe, I don't know, doing whatever serial killers might be doing. Turns out this is a guy who's already dead. This is what, you probably.
He's already dead.
He died in 2023. So it's a scam. It's fake news. If you know anybody that's been alerted and maybe be fearing about that issue, you can let them know it's not a real thing. So put your mind at ease. Mountain House is still safe and secure. For those who have reposted that, you might want to go back to your page and let people know that that's not real. Maybe pull it down if it hasn't already gone down. The original post was removed, and it's not real. Okay, so.
Hi, everybody. This is Dr. Satyakant Chitturi. I'm one of the managing owners of Assure Primary and Urgent Care, located in a wonderful mountain house beside Safeway. Today, me and Brian came up with a good topic, which is pertinent to the current medical illnesses right now in regards to the respiratory illnesses. So there are so many questions being asked by the patients. Many people still wondering what needs to be done. And also, we thought it will be a good topic to start our podcast. So with no further delay, I would like to get into the topic. So we are right now in a quademic state. Quademic. So it's not pandemic or epidemic, it's quademic. So it's seriously high levels of 4 different viruses going on right now. One of them being coronavirus, another one is the influenza virus, and the RSV, and in addition to that, the norovirus. The norovirus is the one that causes severe diarrhea, and other 3 viruses, the coronavirus, influenza, and the RSV, cause severe respiratory illnesses. So the California Department of Public Health, they do wastewater testing in various counties and places, and there is extremely high levels of COVID and corona and influenza virus in the wastewater, and there is moderate levels of RSV in the wastewater, which means even though the number of patients might be less, but the prevalence of the virus in the community is extremely high, for which we need to take all the precautions, which we are going to talk about later in this presentation. And the predictions of the CDC is that in the next 2 to 3 weeks, the influenza virus cases are going to go up. The way that it is going up, so by end of January, the influenza cases are going to go up, but the COVID and the corona cases will be remaining at the same level, or by the end of January, it will tend to be lower than now. RSV cases are expected to be at the same level. So the every state has different level of activity for the viruses, and right now across the US, the the two highest level of states are in Hawaii and New Hampshire. Hawaii might be expected because it's this time of the year where people travel to Hawaii and for their vacations. It might be one of the reasons why the Hawaii is in the very high level for the virus numbers. So people who are traveling to Hawaii, please take the precautions before you board your flight. And California is listed as moderate activity right now. It was low last month, and now it is upgraded to moderate activity. So in the number of testing, there's 20% positive rate of influenza compared, like, for example, if you test like 10 patients, at least 2 to 3 are turning positive for influenza, while the COVID rate is like 6% and the RSV is 8%, which means the influenza rates are very high, and that there is extremely high hospitalization rates in all age groups, not even old people or young people, even the middle-aged people. The influenza hospitalization due to influenza infection, influenza is nothing but flu in common language, is extremely high. And so things to look out for. I would like to talk about the symptoms for each infection. But I would like to mention that if any of the viewers have any questions for me or Brian, please feel free to text in the comment box, and we can answer those questions before end of the telecast today. So the symptoms are mostly same for all viruses, influenza, COVID, and RSV virus. Mostly symptoms are like common flu-like symptoms, where you have nasal congestion, runny nose, headache, fever, extremely high fever, nausea, vomiting. Some people can have diarrhea and sinus infection and all. And these symptoms can last for 8 to 10 days. And the most common way of transmission of these infections is through droplets, which means like if when you talk or when you breathe, you make droplets and they are spread in the air. And when people inhale these droplets, they tend to get these infections. And when they get these infections, they can transmit to others. The other way that infections can spread to is when the droplets fall on any substance like furniture or any chair, or in a towel. When you share linen with people who are infected, these droplets, when you touch your eyes or touch your nose or mouth, the infection can spread. Cross spreading can be there, where people from in the same family with the infection can transmit the infection. So I would like to talk about the testing. There are different ways of testing. There is rapid antigen testing for the COVID, flu, and RSV testing. And the results are available almost in 10 to 15 minutes. And these rapid antigen tests have very good sensitivity rate, which means if they are positive, more than 90% of the times they're positive. But for any reason, if they're negative and the physician suspect the patient is most likely has influenza infection, then the other testing is called PCR testing, which needs to be sent to the labs. So there have been some patients asking what needs to be done if you get the infection. What are the medications that are available? So people who are at high risk are young population, older elderly people, and people with other medical comorbidities. Like other medical comorbidities can be high blood pressure, people with diabetes, obesity, even with mental health problems like depression, anxiety, or people who do not have any physical activity. These are people with high risk conditions for whom even these mild infections can make it complicated and leading to end organ failure, such as heart problems, kidney problems, or severe lung infections that will require antibiotics and admissions to the hospital. I'm sorry. So so there are so many medications that are available for patients with various infections. COVID, for example, if you start them on medication within 5 days of onset of symptoms, they can the duration of the infection with the symptoms will decrease, and also the level of transmission rate will also decrease, and there is less likely that patients will have complications from the infection. Likewise, for influenza infection also there is Tamiflu, but it needs to be started within 48 hours of symptom onset. So it is very important that if you are having any symptoms, starting at like very severe symptoms, or any symptoms with, if you have if you even have mild symptoms with other medical conditions, it is very important that you get tested as soon as possible, so that you can be started on medications, because starting on medications after 3 to 4 days will make no difference. And well, for RSV infection, especially young kids and people 65 years and above, it's very important to get tested for RSV, because they can cause severe lung infections and lung failures. And people need symptomatic treatment for RSV, but it's very important that now the CDC and FDA recommend RSV vaccination for infants and people who are 65 years and above with medical comorbidities. There is a single dose of booster RSV, which is covered by most of the insurances, which is highly recommended at this time during this pandemic period. And other way to reduce the effects of the influenza infection is to get the flu vaccine. So many people that we are seeing in our Assure urgent care with influenza infection, most of them are not vaccinated with the for the flu for the flu shot. So a flu shot is an annual vaccine which is highly recommended to take. And the COVID also, there is an updated COVID vaccine which is recommended for the high risk individuals with elderly population with medical comorbidities. So these are the annual vaccines which are recommended to avoid complications from infections. It is to be noted that these vaccines are not they do not prevent the infection. They can help you fight the infection in the initial stage, and they will prevent worsening of the infection. Basically, even if you get the infection, or if you get a flu shot, your symptoms will be much milder and much lesser duration than any patient who got a flu infection without getting a flu shot. So it is very important that you are vaccinated in a timely manner and do not neglect it, because we have seen many patients with simple influenza infection who ended up with renal failure. So what precautions need to be taken after you get the infection? So mostly the updated guidelines, previously until a few months ago, they had CDC and California Department of Public Health had different guidelines for different infections, different for influenza and flu. But the updated guidelines for current respiratory illness have it made it easy. You have the same guidelines for any respiratory illness. So basically, as we all know, once you are having symptoms for the respiratory illness and you did not expose anybody in your family or not exposed to you, it's better to isolate yourself from them, get tested, and if you test positive, it is better to be on isolation as much as you can, avoid meeting public, and you need to be in isolation until the symptoms get better on overall basis, and you need to be fever free for at least 24 hours before you come out of isolation. Previously it used to be 5 days, 10 days and all. Now if your symptoms are better in 2-3 days, you can still come out of your isolation. So basically
That's true for COVID too.
True for COVID too. True for COVID, RSV, influenza, any infection. You need to be on isolation and if you are symptom free, basically fever free for 24 hours without any medication. That's important. If you take Tylenol, if you see fever gets better, that doesn't count. You should not be on any medication for fever like Tylenol or ibuprofen for 24 hours. And your symptoms overall, your symptoms need not go away completely, but if the symptoms are getting better, you can come out of isolation. And when you come out of isolation, you need to take precautions for the next 5 days, especially if you are in a crowded indoor settings. Precautions like wearing a mask, or make sure that you wash your hands when because you can still contagious, but less likely to be the amount of contagiousness is less, but still you need to take the precaution. If it's outdoors, you need not take any precautions. And immunocompromised patients can be contagious for longer duration than others. Immunocompromised patients means patients with cancers, patients with on medications, which for other medical conditions like patients on infusion medications, or patients with diabetes and which is uncontrolled, and chronic kidney disease are also considered as immunocompromised patients. So these patients can be contagious, which means transmitting the virus from one person to another for longer duration of time compared to others. So some things to note is incubation period. So incubation period means the time frame between your exposure to the infection and the onset of symptoms. So for influenza infection, it is 1 to 4 days, the incubation period. But the COVID is 2 to 14 days, and RSV is 2 to 8 days. So basically, if you are exposed to somebody yesterday, you might necessarily not have the symptoms. You need to give an average of 4 to 5 days for all three infections together for the incubation period. And the contagious period can be even before your symptoms start. For all these infections, the contagious period can be 2 to 3 days before the symptoms start. You can be contagious. Contagious means, again, transmitting the infection from you to another person who is not already infected. And so any questions do the audience have so far?
I'm not able to get to that because we're on here. I think if I go to the other, you could probably look there and just scroll down. So I got a flu shot this year. It's first time in several years I've gotten a flu shot. And then I was exposed to the flu virus. And I think there was one night where I felt a little bit of effect of it. But then I slept and was fine the next day. I've heard and read that sometimes the flu vaccine misses the mark. They kind of guess at what virus, what strain of the virus they're targeting. Is that the right way to look at that?
So these infections, flu, COVID, and all these infections, they are very, the viruses are very smart. They change their morphology. They change their the substance on their body every year. And even though they change, there might be some cross connection, like they still might have some particles on their body which are from the past. Even if the guess is wrong, it might not exactly be the same, but still it is better than completely missing the vaccine.
It seems to have worked this year.
It seems to work this year.
Have you found that the vaccinated people are doing
better?
Yes. The idea is really keep people out of the hospital and having a really
correct bad infection. And these things can be managed at home for most part, if they are treated in a timely manner.
Ooh, were those questions?
No, there are no questions. I'm just checking if, I don't think we have any questions.
So you're seeing quite a few cases of the flu, or all three of these?
All three, yes.
Are there there's a lot of COVID going on?
A lot of COVID too, yes. But so more influenza infection, influenza A and B, and some COVID too, more than RSV. There are not many strep throat cases this year, especially in our area. Mostly influenza and the COVID.
And you really wanted to come on tonight just to alert people to the extent of the flu virus going around.
Correct. Right? Yeah. And the flu and the COVID.
And so it's not too late to get a vaccine for that?
It's not too late to get the vaccine. So we have seen so many patients who are not vaccinated. Surprisingly, even the kids are not vaccinated for the influenza vaccine, which is surprising to me, because it's a parents should sometimes parents just they don't know the severity of the illness, how bad it can be.
And
That's
there's
that's
so
the most
much
common reason.
there's so much anti-vax disinformation going on out there too that
Yes.
people are afraid to get vaccines.
Yeah. So yeah, but that's a different ideology altogether, for a different platform to discuss. But me myself, I feel like it's important to get vaccine, but that's a different discussion.
Well,
Yeah.
I for one am very glad that I got vaccinated this year. It
Right.
paid off because I was directly exposed to it and didn't
So
suffer
it
for it.
worked. Right.
So
Right. So. I would like to summarize the topic. What we discussed so far, we had some new viewers joining. Uh, Basically, if you have any symptoms, try to get tested sooner so that the treatment can be started sooner. If you have any, if you are not vaccinated, go tomorrow or as soon as possible and get vaccinated for the updated influenza vaccine. And the testing should be sooner than later. As I said, explained earlier, it should be within 2 days of your symptoms start. If your symptoms are mild, it's okay, but if your symptoms are severe, don't wait, because the medications for these infections should be started within 2 to 3 days of the symptom onset.
but if you're experiencing symptoms, you don't want to go get vaccinated then.
Yes,
right?
yes,
It's too late, right?
you will wait until the, yeah, actually it's too late. If you are not vaccinated for influenza this year, if you get influenza infection, you can wait till next year. Yes. So I have been asked by some patients about, I think some people are texting me the questions. Yeah, they are saying that they could not.
Do we not have questions?
Yeah, they are unable to
Comments
comment.
turned on. That would be par for the course for tonight because it's been a challenge making this work. Oh, look, I got onto that. Maybe I can see.
Yeah, I think we are unable to.
Yeah, I don't see that I have.
Yeah. In the meantime, I will talk about the bird flu virus that has been going on. Many people were asking about the new H5N1 avian bird flu virus that is a new thing for this year, and many people are scared about it. So, good news about it is, so far there is no evidence of human to human transmission of the bird flu virus, and it is transmitted only from animals to humans, and that's it. It does not get transmitted from humans to humans again. And this is most commonly seen in people who work in animal farms, and also people who handle raw milk and raw eggs, and those kind of people. And the other way it is transmitted is consuming raw milk products, and the raw eggs. So in any animal infected with avian bird flu, and if you consume the products from that animal for raw milk and raw eggs, you can get the new avian bird flu virus H5N1. But again, you will not be able to transmit the virus from yourself to another human. So the way to kill this virus is pasteurization. So it's highly recommended to drink only pasteurized milk and cooked eggs. These methods will kill the virus in the infected raw products. And there are total of 38 cases as of January 15th this year in California of this new H5N1 avian bird flu virus, and there is no evidence of human to human transmission. So, how to mitigate the symptoms of the avian bird flu virus is, again, the regular influenza, seasonal influenza vaccine will protect you against the adverse effects of this avian bird flu virus. And CDPH highly recommends the farm workers and workers in this manufacturing and this packaging factories to wear PPE, such as like face mask and eye shields and clothes, because these droplets, if they fall in your eye, you can still get the bird flu. And it's better to work outdoors or in an indoor location which is well ventilated, and once you're done with your work, wash your hands. so that even if there are any droplets, you don't transmit them to yourself. Okay, again, there's the H5N1 bird flu virus. There is no evidence of human-to-human transmission
in California.
Anywhere.
Anywhere?
There's no evidence of human-to-human transmission so far. Yeah.
But there's been people in the South, I think, that caught it.
They caught it from the animals directly.
But they're not transferring it to other humans.
The virus is so far it's not
contagious. Wow.
Yes.
Had not heard that.
Yeah.
So I will post this to the Mountain House Matters Facebook page as well. So you could always ask some questions there, and we will monitor that so we can check for questions and hopefully address those there. I'm trying a new streaming service here to the YouTube channel, and I can't see whether you're getting the ability to ask questions right now. I'm sure I'll look later and go, oh, yeah, had to click that button.
What happened?
Nothing. I don't know. No, I think we'd have to go look and see on the settings. I just don't want to turn anything off, you know?
Yeah, I'm just... Okay. Let's see if people...
So any other words of wisdom you want to share? People know where you're located in the Safeway Center, so if they need to see you, they can just drop in, right?
So yes, we are the first and the only urgent care in Mountain House. We are located by Safeway in Mountain House, Assure Primary and Urgent Care. We do both primary and urgent care, and now we have the in-house testing available for our patients that we are offering, and we accept all insurances for urgent care services. So feel free to visit us in case of any sickness.
I guess you could vaccinate people there too, huh?
We can vaccinate our primary care patients, yes. Yeah. And I want to add a few more things. One more thing. This month is a thyroid awareness month. So even though our topic today is respiratory illness, I want to educate people a little bit about the thyroid awareness month, which means people with thyroid disorders. It is very much underdiagnosed in the general public, the hypo and hyperthyroidism, which means low and high levels of thyroid. So it is very important to get annual labs done to get your thyroid levels checked, because thyroid is like a fuel for your body. You need it for basically everything. You need it for good skin tone. You need it for good heart rate. You need for good bowel habits. For your breathing. It can cause depression. So many things if you don't have enough thyroid in your body. So the thyroid awareness month is January. So make sure that you're well educated, made yourself aware of the thyroid problems, and make sure that you get thyroid tested in your annual labs.
So what are some ways that people can have a sense that maybe they're having issues with their thyroid?
So common, more than high levels of thyroid, most common thyroid problem that we see is low thyroid levels. So low thyroid levels can cause depression, low heart rate, weight gain, extremely high weight gain, and constipation, and it can cause depression, suicidal thoughts. It can cause brittle nails. It can dry up your skin. It can cause hair loss. So basically, so many. These are the major symptoms that you see, and it can cause swelling in your legs. And so, if you have any such symptoms, think thyroid as one of the probable cause of these symptoms, and make sure that you visit your doctor and get your thyroid levels checked. So again, January is a thyroid awareness month.
I had no idea. That's good information.
Yeah.
You do quarterly or periodic blood drives at your facility as well, correct?
Yes, we had our last one in September. Well, we have not yet, because the company that we're doing with, they did not have any days open. There are many people in Mountain House who approached me, like a group of people who approached me to host a blood drive so that they can help out. There are very few people that are very much interested. I'm trying to approach the Red Cross Society to help me with the next blood drive. Yeah. Yeah.
I know they do one in Tracy periodically too.
Yes,
They
yes.
should
We have
come
been
out.
doing with Vitilant. We are trying to see whoever can provide us the earliest date. We'll arrange for a blood drive. Again, there is extreme shortage of blood all across US and our county as well. So if there is any blood drive in near your house or in your neighborhood, please go and consider donating blood.
It's an easy thing to do. Just takes a little bit of time, but it's not bad at all.
Right.
Okay. Well, great information. At least we were able to get that
Yes,
out.
yes.
We will look to do these on a regular basis. Hopefully monthly, we're going to do another episode of the Mountain House Health Matters, and hopefully have Dr. Chitturi back, and we will share some more information with you.
Thank you.
We'll probably dress it up to a fancier thing as we go.
Yeah,
We're starting on a low bar here.
Yeah, Brian planned it in such a big way, but unfortunately, we had technical difficulties and we had to hustle around in the last minute. But we will do better in the next episode. Yeah.
So you can go to the Mountain House Matters Facebook page and ask questions there if you're not able to here. I'll look at the settings on the YouTube channel. Maybe you can ask questions afterwards here too. We will monitor those and see if we can get back to you on some of that. Or just call the office.
And they can call the office or they can ping us on our Facebook, or we have Facebook page, Assure Primary and Urgent Care. If you have any questions, you can ping us there. And if you are sick, you can call the office. Yes.
And you guys are open 6 days a week?
Yeah, now we are open 6 days a week, Monday to Saturday. We are closed on Sunday. We are open from 10 a.m. to 6 p.m. And we take walk-ins too. Yeah.
Very good. I had planned to have his ad. If you look in the paper, there's a Mountain House Health Matters section in the latest issue that probably came in your mail today. I know it came in my mail today. There you go. Yeah. And see if I can pull up to the way this day's been going. I won't find it.
Okay.
I did.
Yeah.
Okay, so you can go to the Health Matters page. It's on 22 and 23, and you'll see the Assure ad on 23. Their phone number is 209-758-9900 if you want to give them a call. They're located next to in the Safeway Shopping Center, next to the UPS store.
Next to the UPS store. Yes.
Thank you for your time and being here and sharing
Thank you.
your valuable information. And I hope some people got some good stuff out of this.
Sure.
And
if anybody has any interesting topics that they would like to know from us, we will try to do this on a monthly basis. And if you have any topics, please reach out to Brian on the Facebook page or reach out to Assure Primary and Urgent Care on the Facebook page, and we'll come up with presentations for that.
There we go.
Okay.
Thanks for being with us.
Thank you.
Like and subscribe if you haven't already, and share this or look for it on the Mountain House Matters Facebook page. Have a great night.
Thank you.
Take care.
Good night.